What does implantation bleeding look like? During menstrual cycle, as we have discussed in the previous articles, that ovulation takes place somewhere around the day 14 of the cycle. Any intercourse made during this fertile phase is likely to cause pregnancy, the phase during which egg is viable inside the female reproductive tract. The phase is known as fertile phase. If fertilization occurs, i.e., the union of egg and sperm, the zygote will be formed, the fertilized egg. The zygote initially remains inside the fallopian tube and undergoes complex cell divisions and is later sent to uterus, where it will embed itself in the muscular and highly vascularized uterine walls. The process in which the fertilized egg embeds itself in the uterine walls is known as implantation. The fertilized egg for implantation sinks from fallopian tube into the uterus, and this happens 10 to 12 days following fertilization. Implantation bleeding color. The implantation bleeding color and flow both are important to consider while female is suspecting her pregnancy. The implantation bleeding color is mostly brownish, but sometimes it can look like a reddish blood. In menstruation, the bleeding in the start is light and turns massive few hours later, while the implantation bleeding color is brown with no blood clots, as one is likely to see during menstruation. If you are getting heavy bleeding, it cannot be linked with pregnancy, as bleeding which occurs during pregnancy is generally light. However, if a female is experiencing heavy bleeding, she is likely to have a miscarriage. Implantation bleeding duration is also variable in different females. It might take few hours to a day. Most of the females wonder, what does implantation bleeding look like on a pad? The simple answer to it is the brown to brownish red color blood with no clots. What color does implantation bleeding color look like? Any bleeding which is somewhat between brown to pink in color is an indicator of implantation. The bleeding, if it is massive and red in color, generally indicates periods. There are fewer cases where one gets red color implantation bleeding. The indication is that while the embryo is embedding itself, it has just shed some blood from the linings of uterus. Implantation bleeding symptoms. There is some prominent implantation bleeding symptoms as reported by pregnant females. The symptoms include spotting or brownish to pink discharge, little cramping which causes slight disturbance, headaches and mood swings due to hormonal misbalance. When does implantation bleeding happen? Implantation bleeding takes place as embryo embeds itself in the walls of uterus. As it happens, a little blood is shed which causes implantation bleeding. Chemical pregnancy symptoms. Sometimes while suspecting pregnancy, females get positive pregnancy test while the time they visit the doctor. They miscarry before doctor is able to visualize the gestation sac or any blastocyst at ultrasound. The only evidence of such pregnancy is the positive test result on pregnancy strip, hence it is termed as a chemical pregnancy. This is caused when fertilized egg, due to some underlying reasons, fail to grow or embed itself in the walls of uterus. The females often experience the typical 4 weeks pregnancy symptoms as well. Implantation signs. The very early implantation signs which are reported along with bleeding include slight to moderate spotting, minor cramping or lower abdominal discomfort. When does implantation happen? Implantation occurs after a week or 10 days following fertilization. It is the embedding of fertilized egg inside the walls of uterus. When does implantation bleeding happen? An implantation bleeding is likely to happen when the fertilized egg moves down from fallopian tube into the uterus and embeds itself there. As a result of this, some uterine walls are scratched and the tiny blood vessels underneath it are broken down. You might experience slight bleeding as a result, which is known as implantation bleeding. The implantation bleeding takes place a week to 10 days following fertilization. Some other implantation signs are seen along with the bleeding, which is considered pregnancy markers. Pregnancy implantation. When pregnancy implantation happen in the body, women normally get a feeling of being exhausted, little bit of cramping and some other symptoms like the ones seen just before the start of the periods. It is also seen that period bleeding is mistaken as implantation bleeding by some females. so in order to avoid confusions, the females need to calm down and keep a record of duration of implantation bleeding before the countdown to pregnancy begins. Pregnancy implantation takes place when the blastocyst attaches itself to the uterine walls. How long after ovulation does implantation happen? Ovulation takes place on 14th day of menstrual cycle in healthy and normal females. The egg remains viable inside the uterus for 2-3 days, which once again is greatly dependent on the health condition of female. Implantation happens after a week to 10 days following fertilization. Implantation bleeding and cramping. Implantation bleeding and cramping takes place when fertilized egg implants itself in the walls of uterus. Keeping a record of duration of implantation bleeding is very important, as a female experiencing heavy bleeding during pregnancy can take all the precautions to keep the baby safe. Implantation bleeding takes place as earliest signs of conception, and it can also be seen as a result of sexual intercourse with partner. Implantation cramps vs. period cramps. Implantation bleeding and cramping are regarded as earliest pregnancy symptoms. Implantation bleeding and cramping are different from periods bleeding and cramping, as the bleeding and cramps which takes place during periods are somewhat heavy and massive. You might need painkillers to get over period cramps, and likewise the period bleeding will last from 3 to 5 days. When does implantation cramp occur? Implantation cramps occur at the time of implantation, when blastocyst finds its way to the uterus for embedding and getting nourishment from the maternal body. Implantation bleeding and cramping in majority of the cases occur at the same time. Where do you feel implantation cramps? Implantation cramps are felt in the lower abdomen as a slight pressure that is exerted on the uterus. Hence, to conclude all the things as mentioned in the article, implantation bleeding is something that is quite common in pregnancy, and it generally is not a reason to worry. However, if you are facing some other complications along with implantation bleeding, like severe cramps, reddish blood along with back pain, you must seek immediate medical attention, as they might be an indication of chemical pregnancy. General facts about implantation and implantation bleeding. There are some key factors which are associated with implantation bleeding, and it has to be kept in record. The discharge is much lesser as compared to period discharge. The cramping is mild as compared to that which happens during periods. Brown to reddish brown discharge is normal, while bright red colored discharge can indicate some problem as well. As the pregnancy begins and you check it via pregnancy strip or home kit, you must consult your doctor to make you and your baby well protected. Read more info about this article. Check the link below in description.